Sure, I'm all ears.
So I've been having some concerns with my younger sister, Bianca. She is a heavy drug user, and I'm not really sure what to do about it.
How old is she?
She's 22.
That's really young.
Yeah,
Has she had an overdose before?
No, but I'm really worried she will, and she doesn't seem to know what she's doing. My parents and I have been wondering if we should be keeping a Naloxone kit in our home. I mean, even if we did, neither my parents or I really know how to use it.
Well, I get the sense that you and your parents are interested in learning more about how to use it. So how about this? Tomorrow, ask your parents to come in near the end of your clinical shift, and I can show you guys how to properly administer it.
Sure, I think both my parents have that day off, so sounds good.
Perfect. See you tomorrow.
See you then.
Come in. Hi.
Hi. This is my mom, Karen, and my dad, Fred.
Hi.
Hello.
How are you guys today?
Good, how are you?
Good. I'm Janet. I'm the
Okay.
nurse here.
I've been better.
Oh, yeah.
Let me rest my old knees here.
Okay, so Stacy has brought up some concerns that your other daughter is having some drug use, and you become concerned. So she said that you guys have been interested in learning about Naloxone kits. Yeah. So what's the daughter's name?
Bianca.
Bianca. When did the symptoms start?
About a year ago, she had a horrific lacrosse accident, and she really blew out her knee and had to go in for surgery. And I know the chances were pretty low, but apparently after she got on the painkillers, she just couldn't kick them.
Yeah.
And she was out on the streets, shooting and snorting, and
Yeah, that's what can happen with opioids. You get dependent on, a low strength one, and then it just kind of escalates from there. What kind of symptoms are you guys noticing from her?
She's always tired, she doesn't eat, she doesn't change her clothes or shower. She brings over weird people at her house, or she's never home.
I think she's stealing from us.
Okay, so all kind of symptoms of some drug use, not usual symptoms, or not usual behavior from her?
Yeah, it's not normal for her. She was such a good little girl. But when she lost the lacrosse, she just didn't have anything else, and she just filled up that void with the drugs.
I'm sorry to hear that, but I'm here to help you guys. Thank you, Stacy, for bringing this to my attention. Okay, so this is an Naloxone kit. I'm just going to open it up and show you the contents.
Where would we get one of those?
Just at your local pharmacy.
How much? Sorry.
Oh,
How much is it?
It's free, actually. If you just ask for it, it's behind the counter, but it is free. Okay, so in the kit you have gloves, you have a rebreather, you have a couple alcohol swabs, you have a few needles, 3 needles, you have the actual Naloxone doses, and you have an instruction guide.
It seems very complicated. Are you sure we can do this? Our daughter's a nursing student, but we're untrained.
Hopefully after today, after some education, you will be competent in administering this if your daughter so happens to have an overdose. So we're just going to start with the instruction guide. Okay, so this is not going to work if your daughter is doing cocaine, Molly, those type of drugs. It's going to work on opioids. Morphine, Dilaudid, heroin, fentanyl, oxycodone, oxy. Do any of these look familiar that your daughter is using?
Was she on heroin?
I've seen the heroin.
Yeah, heroin.
Heroin?
Yeah.
You found heroin in her room?
Yeah, and I think she's got a bit of the meth teeth.
Is
That's
she?
a thing, right? Meth teeth?
Yes.
Yeah.
Okay, so it is getting serious.
Mm-hmm.
Okay. So yeah, heroin will need naloxone in the case of an overdose. What an overdose actually looks like is the person cannot stay awake, they cannot walk or talk, they have slow or no pulse at all, they have slow breathing or no breathing and lots of maybe gurgling. The skin looks pale or blue, feels cold, pupils are pinned or eyes are completely rolled back actually. They might be vomiting, the body might be very limp. They have no response to noise or knuckles being rubbed on the collarbone right here.
This sounds so scary. How do we know what to do in the event of an overdose?
Well, I actually have an acronym for you. It's perfect. It's called SAVE ME, and we're gonna go through it. So with SAVE ME, we have S, and that's stimulation. Can you wake him up? If not, call 911. To wake
How do you wake them up?
To wake them up, you can either use a noise, you can yell in their ear, or you can tap them right here. It's actually very uncomfortable, and in the event of a CPR situation, that's what they recommend doing, tapping right here. Second, airway. Make sure there's nothing in their mouth that can stop them from breathing. This might be vomit, perhaps, as you know, they can vomit when they're in an overdose. And so to clear the airway, you're just gonna wanna use your 2 fingers and do a swoop, or you can turn them on their side and just kind of empty the contents out of their throat. The third, ventilation. Breathe for them. So to do this, you're going to plug the nose, tilt the head back, and give 1 breath every 5 seconds for 2 minutes. So for a nursing student, you're going to have CPR education, so you're going to know the more in-depth steps of CPR.
Right.
For the parents, I would recommend taking a CPR course just for your situation, but that is the basic steps of, giving them some air. 4 is evaluation. Are they any better? Are you trained to give naloxone? And hopefully after today, you will be trained. 5th is muscular injections. So for you, Stacy, you're a nursing student, you're going to be a future nurse. You know all about IM injections. I'm sure you've done them in lab recently.
Yeah.
So if you encounter an overdose, you're going to use all those proper IM sites.
Okay.
For the parents, you guys aren't educated on that. So I'm going to show you where the proper sites would be for an IM injection. So if you look over here, we have, so if they are having an overdose and they're on their back, you're going to want to focus on the deltoids right here or the top of the thighs. If they're on their stomach, you're going to want to focus on the back on the deltoids or at the top of the buttocks. Those are kind of those muscular areas. If you aren't administering into the muscle, it's not going to work. So it's very important that you get these places. And lastly, we have evaluate and support. So is the person breathing on their own at this point? If they're not awake in 2 minutes, give another 1 ml of the dose. So that's why we have 3 doses. You can give up to 3 doses if it's not working. If it's still not working, you've already called 911, they're on their way. And also, it's important to tell the person not to use any more drugs. This is actually proven effective after an overdose. But just be aware, they are probably going to be irritable when they wake up. They're coming out of a high, they're being kicked out of that high essentially, so be prepared for some irritability, but of course irritability is better than a successful overdose.
Does naloxone actually make you high?
No, it actually doesn't at all. It's going to do the opposite effect. It's going to take away that high, it's going to help with the breathing.
So I have a question. I, as a student nurse, know how to use a needle, but can you show my parents how to do the injection or drop the medication just in case I'm not there?
Yeah, of course. So yeah, you have 3 little bottles right here. And so as you can see, it says flip off. So you're gonna flip off this. You're gonna open up your needle. Just be mindful, try not to touch the end. You don't wanna you're gonna have gloves on obviously, but you just don't want to get any sort of bacteria on that end because you are going to be penetrating the skin. So you'll open it up. Have you ever used like a turkey baster? You know? Yeah. So you're going to put that right into the dose, into the medication. You're going to retract the plunger all the way up until all the medication is in the needle, and you're going to inject. For you, Stacy, you're going to use your nursing skills, obviously. You're going to do the aspiration and all that. Yeah. And what's very important to remember is you want to clean off the area that you're going to be injecting with an alcohol swab first, just to, again, eliminate any chance of infection.
Okay, that sounds scary, but I think if we have to, we can do it.
Yeah, it is pretty simple. So does that cover everything for you guys? Do you have any more questions for me?
I think I'm good.
Yeah. Good? Okay. So in the future, if you do get any more questions or anything, you can call HealthLink. It's 811, and it'll be a registered nurse, and she'll answer any questions that you have.
Okay. Thank you very much.
Yes.
We really appreciate all your help
You're
today.
very welcome.
Thank you for helping my parents.
Of course.
Go. That was a really informative meeting. I'm glad we stopped to pick up a Narcan kit on the way home. Oh no! Bianca!
I'm overdosing on heroin.
Do you remember the acronym?
Save me!
I think
Quick!
you're right. Hello? Now what?
Somebody call 911. We'll stay with her. Check her airway. She's full of vomit.
Okay.
We need to ventilate her now.
Okay.
Just use your mouth, you're her mother.
Now what?
Is she getting any better? We're evaluating her.
No.
Oh no. Okay, we need to give her a muscular injection.
Okay.
1 milliliter.
Come on.
I'm panicking.
Good thing you have a
Hey, I'll
Narcan
flip off
kit.
this.
Flip it off. Okay, here we go.
Okay.
Right in the thigh.
Yep.
Boom.
You saved me.
Thanks to Narcan. Don't do any more drugs.
Okay.
Hooray!
Thank God for Narcan.
I'm Bianca, and I'm so thankful for the Narcan kits. I'm an opioid overdose survivor, and without the Naloxone Narcan kits, I would not be here today. I'm also extremely thankful for my sister, who talked to a nurse, who got my parents involved to help learn about the Narcan kits, to know when to administer and to explain the processes of overdose. I'm not proud of the use of opioids or the overdose, but it also opened my eyes. Seeing my parents and my family like that were devastating. Now I am currently researching rehab programs and facilities to help better me and give a quality of life that I deserve and a quality of life that my parents want me to have. Don't do drugs, bad idea.